Conscious Bites, Milk to Solids, Part 15.
Miss Dietitian, can you explain in more detail about milk allergy?
A milk allergy is also known as cow's milk protein allergy, or CMPA for short. It affects around 2 to 3% of 1 to 3 year olds. It's when you're allergic to either or both of the two proteins, casein and whey, which are found in cow's milk. What about lactose? Lactose is a sugar and not a protein, therefore does not behave in the same way in the body as proteins do. Cow's milk contains fat, vitamins and minerals, and the proteins, casein and whey, and the sugar, lactose. Casein and the whey produce an immune response, which gives you the allergic reactions, whereas the lactose produces a digestive response. It's when the intestines do not produce an enzyme needed to digest lactose.
So lactose intolerance is not an allergic reaction?
Exactly. Lactose intolerance is not an allergic reaction, but the symptoms such as flatulence, diarrhea, bloated stomach cramps and pains are similar to cow's milk protein allergy. A child with a possible CMPA will experience similar symptoms to other food allergies such as dermatological symptoms, respiratory symptoms and gastrointestinal symptoms. Sometimes a child can suffer an anaphylactic shock to the food, so requiring urgent medical attention. Once you suspect a cow's milk protein allergy, then make an appointment with your GP or health visitor and start to keep a food and symptom diary. Your GP will take an allergy-focused clinical history from you about your child and confirm if your child has an allergy to cow's milk protein. Once a diagnosis has been made, your child will start a cow's milk-free diet. Ideally at this point, a referral to the dietitian should be made to ensure nutritional adequacy for growth and development. Depending on the symptoms, whether they're IgE mediated or non-IgE mediated, your child may or may not be referred to an allergy clinic and be seen by an allergy specialist nurse and consultant for examination and appropriate allergy tests. If the baby is being exclusively breastfed, then the mother will be requested to avoid cow's milk in her diet and ensures that she supplements her diet with 1,250 milligrams of calcium per day, 10 micrograms of vitamin D per day, and 250 micrograms of iodine per day. If your baby is partially formula fed or fully formula fed and is between 0 to 12 months, they will be prescribed hypoallergenic milk formulas as the main milk substitute. There are two types of hypoallergenic formulas which are available on prescription. Extensively hydrolyzed formulas is the first line choice for formula fed infants with cow's milk protein allergy. In these formulas, the proteins have been broken down extensively into tiny proteins than the ones in cow's milk and soya-based formulas. There are some babies who do not tolerate the extensively hydrolyzed formulas, so are offered an alternative amino acid-based formula, but the proteins have been broken down into amino acids. Other reasons for prescribing amino acid-based formula is when there is a history of anaphylactic reaction, faltering growth, in addition to severe gastrointestinal symptoms, or the baby has had a reaction to the cow's milk protein in breast milk, and if symptoms have not resolved within 4 weeks with the extensively hydrolyzed formula. It has been observed that babies on the extensively hydrolyzed formulas, in particular with LGG, are more likely to grow out of their cow's milk protein allergy compared to those prescribed the amino acid formulas. Lactobacillus rhamnosus, or LGG, is a unique probiotic which has been shown to relieve cow's milk protein allergy symptoms affecting the skin and gastrointestinal tract. Soya infant formulas are not considered for babies under 6 months of age due to concerns about possible effects to reproductive health. However, after 6 months or older children who are not allergic to soya, have a negative IgE to soya, or have a non-IgE mediated allergy, may find soya beneficial when added to their diet. As milk is a vital source of nutrition and also added to many foods, it can become quite overwhelming when asked to avoid it. Often, children with cow's milk protein allergy may have an allergy to goat's milk and soya too, so these foods may also need to be avoided. It is difficult not to worry, but remember your dietitian will support you by giving you alternatives. Your dietitian will tell you where cow's milk is found, other names for cow's milk, give you a list of additives which contain cow's milk, and foods which you would not expect to contain cow's milk. When shopping, it's important to check and understand food labels by reading the ingredients list to make sure products do not contain any milk. Allergens such as milk should be listed in bold, italics or underlined or highlighted to emphasize that the product contains it. The may contain warnings are not compulsory by manufacturers, and do be aware that there will be a possibility of potential cross-contamination in production and packaging. When eating out, don't take risks and ask the staff if the food contains milk or milk products. Taking milk out of the diet has an impact on calcium levels, which means calcium must come from other foods, such as fish such as canned sardines and canned pilchards, whitebait, sesame seeds and green leafy vegetables.
How much calcium do we need?
The amount of calcium we need depends on our age.
I suppose it's not too bad when they're babies, as they can take hypoallergenic milk formulas, but the introduction to solids could be challenging.
Absolutely, starting solids for a child with any food allergy can be quite daunting. Luckily, there are a range of free-from foods available in most supermarkets, labelled milk-free. While the hypoallergenic formulas provide calcium from 0 to 12 months, they do not continue to provide sufficient calcium over 1 year old. Suitable milk alternatives such as almond milk, oat milk, when enriched with calcium, can be added to food and as a drink over 12 months. Find calcium-enriched milks with 120 milligrams of calcium per 100 mils, as this is equivalent to the calcium content in cow's milk. Also, it's good to know that the organic versions of these milks will not be calcium-enriched. Some parents still prefer to continue to use the hypoallergenic formulas beyond 12 months, but this is only recommended if they have multiple allergies other than cow's milk protein or are allergic to the alternatives at 12 months. Children not meeting their calcium requirements would benefit from a calcium supplement. Rice milk must be avoided until 5 years due to its arsenic content.
What is the likelihood of my child growing out of the cow's milk protein allergy?
Around 80% of children are able to reintroduce cow's milk into their diet by their 3rd birthday. When it is safe to be re-challenged with cow's milk, then the IMAP milk ladder is used in coordination with the dietitian and allergy services, possibly starting off with baked milk products such as biscuits, either as home challenges or under medical supervision at hospital.
I see.
Miss Dietitian, I'm thinking of breastfeeding Ajay until 6 months as I need to go back to work. How do I stop breastfeeding?
Hi, I'm Miss Dietitian from Conscious Bites. Hope you enjoyed this episode. Please leave comments below and don't forget to subscribe. Follow us on Facebook, Instagram and Twitter. For more information, you can email us or check out our website. Bye!